welcome everybody. We're going to let a few more people in from the meeting room. I think that everyone appears to be in from the meeting room, and we'll continue to keep that actively open for us. Welcome everyone. My name is Mike Grant. I'm with the Marin County Office of Education Rethinking Schools Task Force. And I'm joined today by Janelle Campbell, who is our Special Education Director and also on the Rethinking Schools Task Force, and Melina Boyd, who's going to help kind of run the show and help with our chat box and questions and answers, and then Dr. Lisa Santora and her awesome team from Marin County Public Health. So Melina, you want to go to the next slide and we'll just kind of review what the agenda is for today. The first part is just to welcome Marin County School Public Health Liaisons. The role that you have stepped into, we view as just critical to our ability to offer site-based classroom instruction in the safest possible way for our students, staff, and community. So thank you for jumping into this role. For many of you, you've been through the one or two of the trainings that we provided earlier in August and September, and may have joined us for our workshop last week. This is the second in a series of 4 Thursday afternoon workshops that's designed as kind of a update and Q&A as we enter further into the fall of this most unusual school year. So our agenda today, Dr. Lisa Santora, our Deputy Public Health Officer, is going to give us an update of COVID-19 in Marin County and some of the new information coming around tiers and key indicators and a new metric. I'm going to give a brief snapshot of kind of where we are right now with our current school status and a brief review of the role of the Public Health Liaison. And then Janelle Campbell is going to give us a real-time student COVID positive response experience that we have experienced the week before last. Initially, when we thought about this series of workshops, we thought we could do some tabletop exercises, scenarios, but this is a real life scenario that Janelle is going to walk us through and tell us about, which we think will be very useful. And then we'll open it up to questions and answers, which we hope will be the majority of our time together today. So with that, I'm going to hand it off to our amazing Deputy Public Health Officer, Dr. Lisa Santora. Welcome, Lisa. Thanks for being here.
Thank you. And again, thank you, everyone. We really appreciate your time, and you really are going to be play such a critical role in how we reopen schools safely and safer. Safer is probably safely and safer as we move into being allowed to reopen. So we have filled our commitment, and we've remained on tier 2, which is the red 2, for the required number of weeks that now allows for schools to reopen in Marin County. And so we're working with, as you all know, each different district is different. We have a number of schools that have already opened or are scheduled to reopen in the weeks to come. And then we have other schools that are still in conversations with staff and labor on the schedule for reopening. But we are excited that this represents a really important moment for us to move forward and implement all the work we've done with rethinking schools, again, to create those safer environments. So I just want to thank, again, everyone on the phone and all of your teams. You've all played a critical part in helping us get there, not just because of the work you've been doing with your schools, but also the work you've been doing at home, and following our social activity recommendations, that you're limiting activity, that you are wearing face covers, you're maintaining physical distance, and really appreciate this is many moons into it. My kids always remind me it was Friday the 13th in March when we started this, so we're past the 6-month mark, and we still have a ways to go. So we have 2 indicators that we follow very closely. We have both our case rate, and that's the number of cases that have been tested positive over a particular time frame, and then we get an based on our population, and then we get an adjustment for that based on the amount of testing that we're doing. And so the more testing that we do, and the more that we exceed the state average in testing, then we get more credit for demonstrating that we're testing a lot in our community. And so that's one of the numbers that you'll look at if you go on the blueprint for the safer economy. And then the other is that percent positivity rate. And so of all the tests that we have done in Marin County in the past 2 weeks, what percent of them are positive? And so those are the two metrics that the state is closely following. This week, they just announced a very important measure that Marin County fully supports. You might see different conversations happening across the state, but we have always moved in our emergency response and aim to be equity centered, and recognizing that, again, generations of institutional racism have created income inequalities that have that create the conditions of crowded housing and low wage job earning that has increases the risk of COVID-19 transmission in communities of color across Marin County, across the state, and across the nation. So we have always aspired to make sure that we achieve racial equity in our approach. And for example, our work in the canal is an example of those efforts. So the state has launched this week, or announced this week, that they have a new equity measure for the indicators. And so this is going to be something that they use, something called the Healthy Communities Index, to identify the lowest income communities where there would be the greatest health disparities before COVID. And they're going to be making sure that there's not great disparity between the percent positivity in lower income communities across Marin County and in more affluent communities across Marin County. So this is very consistent with our philosophy. Again, you may hear different chatter in other counties, but we feel we have the resources that are necessary to respond and prevent outbreaks, respond to outbreaks and prevent outbreaks in lower income communities. Even though it's challenging, we can't change the social conditions and the living conditions, but we can certainly increase our ability to test, provide outreach and education, and work in partnership with community-based organizations. So we'll be seeing that unfold in the next, in the weeks to come, how we are measuring, and once we have more information on the data. And again, we see it as an opportunity to improve our efforts if we are seeing increasing gaps between communities that have wealth in Marin County and lower income communities and communities of color in Marin County. So we are ready for that challenge. But it will affect it, and it will also be seen how it affects our tier rating. We have, as Marin County has is an affluent community, but also has deep gaps or deep areas of poverty. So this is a challenge that we have to face. It's the reality of living in Marin County and working in Marin County. All of you experience that every day in your work, and so we will see how we navigate this new metric again. But we think it's very important for public health and for the state to ensure that there is equity and making sure that communities aren't just testing in lower transmission areas and more affluent areas, but we're also ensuring that that communities of color and lower income communities have access to testing. So that's important. And I've already mentioned, so it is now permitted by both your local health officer and by the state that schools can reopen with site-based instruction following our 30-point guidance, which is available on the website, as well as the state guidance. They're very much aligned. We've seen just over the past week that LA County and San Francisco County have also released guidance on how they see reopening schools. So we are again seeing a shift in the state. And then the singular requirement is that all schools that reopen must have their school site specific protection plan reviewed by public health. So it's not only reviewed by our amazing public health nurses who are on the call. We have Sandra Rosenblum, Marsha Grant, and Linda Metz, and we have Jenny Stevens, who's also supporting our team reviewing them, but then Dr. Willis and myself, Dr. Willis and I, sorry, good grammar is important, especially in college schools. Dr. Willis and I also review the protection plans. And again, this is because we are so thankful for the work that you've done. We want to make sure that it is reviewed and that we have the opportunity to make sure it's tuned up. And that's what we've seen with most of them, just needs a little tuning up. And we also think it sets the stage for our partnership together with you. That's it. I talked longer than I thought.
Thank you, Lisa. And this was just a slide to review what you just did, is the awesome team that you have there specifically to support our schools. So we appreciate you putting that together. What I wanted to add to this is that this, the HHS COVID-19 schools is, I guess, is public by the fact that it's on this slide. the phone numbers for weekday and weekend are only provided to the public health liaisons and the superintendents as well. So, once you're registered, if you're not registered, make sure to register, and you'll have those and keep those phone numbers handy in the event that you have a potential exposure. Okay. So I'm just going to give a quick overview of our current status. There's 100, as of a few moments ago, there was 105 school site specific protection plans have now been submitted for public health review. Majority of them have been reviewed and are ready to go. There's probably a few that just came in last night that are currently under review. That includes 33 of the schools who have approved waivers that have been approved by both our public health officer and by the state California Department of Public Health. Altogether, we've been trying to gather information. We thank those private, independent, and parochial schools who are in session who have been in session under the waivers. We've been trying to capture information about estimated enrollment and number of cohorts. So with the waiver schools, with the Marin County Office of Education, special education programs and alternative education programs, and also some of the student learning hubs that have opened up over the course of the past few weeks, we have a little over 3,000 students and 259 cohorts that are in session today or will be within the next week or so. And that's very impressive. It equates to 15,000 student days per week and almost 1,300 cohort days per week that are currently in operation or will be by next week, which is a very impressive number. Melina, you can go to the next slide. Okay, so yeah, so this is something that you're all aware of. Just a quick review. The main role of the public health liaison is to be in great contact with public health if there's a potential exposure or a concern about a potential exposure. Your knowledge of the protocols document and scenario 1, 2, and 3. We want you to be fluent in that, the probably the most challenging part of it is how to quickly access and provide public health with the critical information they have. The student list, the family contact information, the staff list and contact information, and any itinerant staff who may have been in contact with the potentially exposed cohort. Every school and district might do it a little bit differently, but it's not that you have to keep that information, but you just know how to get to it quickly. And I'm going to say within 15 minutes, provide it to public health if there's a confirmed or potential exposure. And then to take the appropriate steps to initiate the school communications to those staff and families and kids who are directly impacted. And then also in a more general way to those who are, who may have been impacted. And we did a couple trainings earlier in August and September, which the video is on our website. Okay, we can go to the next slide. This is just a quick snapshot of the exposure protocols that each one of you public health liaisons needs to become very familiar with. We anticipate over time, these will get tweaked and refined and made better and usable for everyone. So if you have input or questions, let us know. Next slide. And of course, at this point, because the state has given us the green light to return to site-based classroom instruction, you can't do it unless your school site specific protection plan has been submitted and reviewed by public health. So if your school or your district doesn't have them in, please get those in. This is a huge priority. And really it becomes the document that really drives your implementation of health and safety measures at your school. And we can't overemphasize enough the importance of the multidisciplinary task force at each school site. So that's the team of people. It's probably typically the principal and assistant principal and secretary and teachers and classified staff, maybe some parents, and in some cases maybe even some students, custodians who are talking, meeting on a regular basis, talking about the plan, how to make it better, where are the questions, where are the concerns, how can we do better at creating the safest possible environment for our students and staff when COVID-19 remains active in our community. So those multidisciplinary task force are really the driver of the triple S double Ps. They make it happen, they implement it, and they take feedback. So as a public health liaison, we want to make sure that you're actively engaged on that task force and supporting the development and growth and effectiveness of that task force at the school site. Okay, next slide. So at this point, I'm going to pass it off to our colleague Janelle Campbell, our Director of Special Education, to walk us through an actual experience that we had about, it's probably 10 or 12 days ago now. Janelle Campbell.
Great, thank you, Mike. Yeah, we thought it would be helpful to share our real life experience, which just happened. It was 2 weeks ago on Friday, so I think the date was the 18th. We received a call from one of our parents in one of our classrooms to notify us that the student's father had tested positive. And so with that information, we knew right away that we were in a scenario 2. We started pulling our information and from our database, our cohort information, information about our students, the staff, all of those necessary documents that we knew we were going to need to get to public health as quickly as possible. So we pulled all that information, sent the email off, and immediately started in communication with public health. It was really great to get that phone call. It was a Friday afternoon, and to get that phone call late in the day was helpful going into the weekend. So we had that immediate communication and really talked through kind of what to anticipate when we might hear back based on knowing the family had said that the student was being tested that day. So we knew that was happening, and we knew when the student's last day of attendance was, so we could start estimating if the test had come back positive for the student, what that might mean. So we had some of those conversations directly with public health following the communications that we sent out for scenario 2. And then it was on Wednesday the following week, we got a call around 10 o'clock from our public health nurse to let us know that the student's test had come in positive. So we knew immediately that was a scenario 3, which was an immediate closure of the cohort. So we took steps right away. We brought our team together, our administrative team kind of divvied up the responsibilities and started making those immediate phone calls to families to have their students picked up from school as quickly as possible. And then started the other notifications as well. And what we learned in walking through this is we actually did a debrief with our team in follow-up. And as a result, we came up with a checklist, because what we found was that it's a lot to pull together in a very short amount of time, and we really need, it's the work of more than one person to get it, all of the communication out that's necessary within that very short time period. So we created a checklist based on all of the actions that we took so that we could be better prepared for the next time it might come up. So we wanted to share with you what this looks like. The top portion here is the facts. What is it that we know in the situation? Was it a student? Was it a staff member? What was the last date of attendance? All of those immediate steps that need to happen. We also learned very quickly, as some of you may have seen in the IJ, information travels fast. And so we wanted to be prepared with what is that public information. Much of this would be considered confidential, but there is information that is important to be sharing out so that the message is accurate as it's shared out there. So we put a section there for just some of those bullet points of what is public information. And then to scroll down, we included what are those action steps that, that we needed to take. And as you can see, there's a lot of them. Not only the phone calls that go out, but also the written communications, pulling the information that needs to go to public health, and then also who are those other people that need to be notified. They may not be directly part of that cohort, but being notified that the cohort is closing is going to be important, like our transportation providers. And yeah, for us, it's our host site district, since our classrooms are on a host campus. And then also the districts who may be impacted, since we serve students from various school districts. The other thing that we ran through were all of those other questions, like, oh gosh, is this a student on the bus? Is that more information that we need to pull? Did we have a sub in the classroom, and did the sub go someplace else? What about the itinerant staff? We really walked through as much as we could of those questions that we were running with, so that we could put them down on a document, so that if this comes up again, which we would anticipate that we're going to be in this situation again at some point, that it's already here for us to run through and be able to divvy up, so that we have multiple people taking responsibility for the number of steps that have to happen. The other thing that we found really helpful was that debrief conversation, where it wasn't just our immediate team that worked on this. We also brought in the liaisons from our other sites, as well as all of our secretarial team who may be pulling the data for us. And we talked about what went well in running through our process, and what were the challenges. And so we really learned a lot about how can we be more proactive on a day-to-day basis to make sure we're checking that everyone who should be filling out those daily surveys are. We discovered that we knew we had a sub in the class, but they didn't show up on the daily survey. And so we realized that, hey, there's more that we can do on an ongoing basis to make sure that our data is clean and accurate. So when it's needed at a moment's notice, we don't have to take the time to call the classroom and really walk through everything in as much time as what it took us in running through this. I think definitely the call to the classroom to confirm accuracy, that there wasn't anyone in the classroom that we didn't know about, was helpful. But you know, I think there's from our end, I think we learned a lot from doing it, and certainly appreciated the great support from our public health nurse, who really walked us through it and answered all the questions around our timelines. What was the date of exposure, so that we knew the substitute who was in the classroom who then went to a subsequent classroom, what was that timeline, and did we need to notify the next classroom that the sub went to that was a close contact, a scenario 2 notification. So for us, it was really helpful to do the debrief and walk through, and now we have this checklist that we'll continue to add to and use to help us move through in a more efficient way in the future.
And so Janelle, you know, the staff were tested.
Yes.
And?
So all staff were tested. All staff were negative. We did have some of our parents report back to us. Not all of them reported back to us on their testing results, but those that did were all negative. And the cohort is back open as of today. So we really feel like it's a good example of all of the protocols that were in place, really doing what we would anticipate in mitigating the spread within the cohort. So this was a situation where the transmission occurred in the home. The student was asymptomatic, never did have any symptoms. and then it did not spread within our classroom cohort.
That's great. Well, thank you for that overview. And I think, and I just want to quickly go to the next slide. So you can see there's a link to we do have the checklist up on our website. There's a link on the slideshow. This will be up on our website, this presentation, as well as the slides with the link, and you can get this checklist, and we'll be updating it as we go. The other thing we also realize is that the district office setting is a little bit different than the school setting. You know, schools are set up in cohorts by design. The office setting is not. So we kind of created a separate template for an exposure or potential exposure in an office setting that we're kind of fine tuning now. We have our current version up on the website. You know, what we also realize that in the office setting, just like in the school setting, actually, the exposure concern or the close contact concern oftentimes would be outside of the school or office setting. Is what were these people who tested positive or may have been exposed, what were the other activities that they were doing in their life outside of school or the office? So we've created a district office checklist as well. You want to go to the next slide? I think we're at questions now. So, you know, again, we feel like that experience was really a valuable lesson for us, and we hope can help inform and support. We know that in our community, when COVID-19 is active, there will continue to be exposures or potential exposures that we're going to need to respond to in the most effective way with public health's guidance. So thanks for sharing that story, Janelle. And now we can open it up to questions.
Katie?
Yeah. So just to let everybody know, we've had a number of positives out there and gone through all the protocols and had no spread within our school either. But I do have a question, like, what's the rationale in terms of keeping that cohort open while you wait for the result? Even though the test has already been done, like, why wouldn't you just keep everybody home for that morning till you get that result?
We have the most common scenario with that, and I'll let my nurses jump in too, and you can err out of an abundance of caution and close immediately. That's, of course, an option. But most of the scenarios that we've seen are the second test they're not negative. So again, there's definitely justification to immediately close the cohort. Again, and I think that's something we are also looking at, also with some of the language around if the parent knows there's different types of testing, right? If the parent knows they're being tested because they should have been exposed, that child should never have come to school in the first place, right? But then there's people that, like us, we get tested monthly, and we're not getting tested because we think we've been exposed and we're not symptomatic, but we're just refining language around that. So yes, that cohort could have been closed, but the most common scenario we see is that student would have tested negative. So that's the justification. Anything else, Marcia or Sandra, to add to that? No. I got it.
Yeah, and so, you know, just to clarify, and I just want to confirm with Janelle, as soon as we knew that the student's parent had tested positive, that student was excluded. Is that right, Janelle?
Yeah, that student didn't come to school on that day,
Right.
even that the parent had called us. So the parent kept the child home.
Yeah, or the next several days until they had been tested and their tests came back.
Right.
So once we knew we had an exposure of one of the cohort members, they stayed home, but the cohort remained active. And we learned of the positive test in the middle of the school day. So you literally closed the cohort in the middle of the day. You didn't finish the day. Is that right, Janelle?
Yeah, that's accurate.
So, and what was the response of the parents when they were called and said, you need to come pick up your student?
Everyone was there really fast. You know, I was really impressed with the family's response. I think they all responded very quickly. Certainly there was a lot of concern. And so after the initial phone call, I think with almost all of them, there was a secondary phone call by later that afternoon where we were having a follow-up conversation with them when they had a moment to kind of sink in and think about it. They had already received the scenario 2 notification. And so it was already on their radar that this would be a possibility. So I think it just, you know, the families by and large were very supportive through it. We did a lot of checking in with the staff and families throughout the closure period, just to check in on how everyone was doing, and which I think was also really greatly appreciated.
And I think that's going to be our norm for the first couple of weeks. Again, first normalizing that this is normal, that this is exactly what we're going to see. It's going to be newsworthy in the beginning. We are preparing a dashboard with which schools are open, which schools might be closed, and cumulative cases among staff and students to start socializing COVID-19 in the school environment. And so the community can see, again, that public information piece is important, so the community can see that we are being transparent about all of the information that we can, you know, protecting the individual information at all times, of course, but again, helping the community see that this is normal, that we have strong public health mitigation measures and prevention measures in place by having the full cohort closure. And again, that close connection between us and the school that is affected is critical. Again, just helping also for parents to start adapting that this is part of their reality of going back to school is a potential school closure. So there's, you know, that is one of the realities of the return to school. So I think it's going to take time. It's going to take a couple of weeks for parents, school staff, schools, the media, all to adapt to something that we have been doing since March. It was a little bit more under the radar, not intentionally so, but I think there's so many other higher profile COVID issues that were from testing, et cetera, that were higher profile to the community. But now with it being fall and schools reopening, we know this is going to be something that's going to rightly so be of interest to the community at large, to media. And we want to make sure that you guys, I think having those communication plans is just really strong, really a key to making sure parents feel reassured. Like you said, getting the scenario 2 notification definitely helps prepare a parent that it could go to a scenario 3, but sometimes it just takes those conversations. And we're here also to help support you and have, you know, if there's any kind of tough situations or interesting situations, they're all out there, but we're also here to help support kind of that one-on-one case management when there might be a family with higher levels of concerns.
So as we would kind of expect on any call where we have, you know, the opportunity to speak with Dr. Santora and her team, there's questions that aren't really specifically related to the public health liaison role, but are more kind of on the ground logistical challenges and questions that are coming up at schools as they begin to contemplate or open doors to site-based classroom instruction. So one of the questions that just came in, you know, and we're going to try to stay focused on the public health liaison topic, but, you know, this is something that we've heard a few times in different scenarios, but is there a limit to the size of a socially distant outdoor cohort assembly for a preschool that includes the parents? So I'm running a preschool. I want to do an outdoor assembly with my kids and parents. Is there a number or any guidance you can provide on that, Lisa?
So correct me if I'm wrong, super nurses, but the parents shouldn't at this time be on the campus. So it really should just be the one cohort that is outside. We're still aiming to prevent any mixture of, you know, like my daughter went to a preschool and they had red door, green door, blue door. So we don't envision a time where outdoors those cohorts are mixing at this time. That may change, but at this time we don't see them mixing. And we don't see parents at this time coming on campus for, we had like Friday morning gatherings and things like that. Shouldn't be part of our return to school. Am I wrong, nurses? No, I'm not wrong.
You are right. And I think what I'm noticing is that the confusion about how far open can we go. So we've received requests, you know, we're sharing our playground with other cohorts, but our playground is actually a shared space with 4 other schools, can all 4 schools use that playground? And so these are the sort of questions that we're sorting through to get, is most, what's the word? Expansive answers, to allow you to function at, but be safe. We're getting all kinds of questions.
Yeah, so the questions are rolling. So, and what's going to happen, Marcia, and I appreciate this, Melina, our Rethinking Schools Task Force has talked about this. As our public health liaisons begin to liaise with public health, they'll have a direct line to your team, and there are kind of more logistical based questions than specific public health based questions. So we're going to try to team up and kind of divide the questions in, we'll take on as many as we can, Marcia, is what I want to say. And then at a certain point, we just need public health's input. And so we'll try our best to, we want the public health liaisons to know that they can come to rapid response for more logistical based questions. And then when we need to reach out to public health, we will. So thank you, Lisa. So Lisa just put a link to the health equity metric. There was a question, someone who came in late wanted more background on a health equity metric. Thank you for that link, Lisa. It's in the chat box.
There's some good questions in there.
Is anyone else trying to figure out how to be the school principal and the public health liaison? Is that a frown, Emily?
Yeah, I couldn't put up any other crazy emojis. You're just like, ah.
Yeah. So here's here's my guess, and Melina, you might know better than me, but my guess is that most principals or an assistant principal will be the primary or secondary public health liaison. Is that fair to say?
Yes, I would say the majority has at least an assistant principal or principal. Yeah.
And so, and we know it's a lot, but really what we realize in our experience is, there's all the normal work of running school, which is important. But at this point in the pandemic in our community, this is the most important role, is the health and safety of our students and staff, and to do everything we can to ensure we're doing things as best we can to make it safe.
And I think what Janelle described also shows the kind of the early leadership that's needed to kind of get the team, to mobilize the team, making sure that that checklist is completed. And especially again with those early cases, as we're all adapting, that this is again part of our new normal, that having the principal leadership, it will definitely provide that level of reassurance to parents and to staff, especially in the early days. This might shift, once your team goes through its first couple of cases and scenarios and you build expertise, and the delegation becomes easier. But I think having that, both being the leader and the role model through these first couple of cases that you'll navigate together with us, it's going to be invaluable for, again, that reassurance role. And then we'll learn together how to be more efficient. But I think it just takes, sometimes it's just getting a couple of the cases under your team's belt, and then that builds the confidence. And that's when we just usually, after a case or 2 or 3, then we're just on the receiving end of just saying, yep, you're doing it right. Yep, you're doing it right. Yep, you're doing it right. But in these early weeks of return to school, I think that leadership is critical.
Yeah, and so, and what we've learned again through our experience, over the course of the past 5-6 months of operating student programs, is that everything else stops. When there's a COVID positive case, all of that critical, important deadline work and important meetings that you've scheduled 3 weeks ago, they all get canceled. The deck is cleared, and this is the focus. So that's hard to do as a school administrator, because you're organized, you have a plan, you have timelines, but this is the most important work. And we know we couldn't do it without public health by our side. And so just get ready for that likelihood. So there's a question here, about, at this time, are adults allowed to interact? By adults, I'm assuming that means school staff allowed to interact with multiple cohorts if properly masked and distanced where possible. And that's good old guideline number 14. I had a call about this today, and the answer is yes. We are now in tier 2, and if you have your school site specific protection plan, staff can visit multiple cohorts, but you have to keep track. There's got to be a way to monitor and track where you've been, so that should there be a future COVID positive case, that you can be in that cohort tracking line. But you do have to, you're acting like you are asymptomatic positive, and like every cohort of students you're working with is asymptomatic positive. So you're doing all of those things that are part of our plan. Okay, are there other questions, Melina or Ken? Are you seeing anything else that's coming up? Okay, this is a good one from our school nurse, Susan Ritter. What about all of the scenario 1 situations? Do you have recommendations of when, how a cough or fever gets reported to the public health liaison? And we had, Lisa, I know you had looked at kind of some flow charts from some other districts. I think LA Unified and San Francisco Unified had put together kind of a flow of the different, okay, my student has a sniffles, can they come to school? How many days do they have to be out if they had sniffles? Can you speak to that?
Yeah, we're finalizing it. It was supposed to be finalized last week, and had a family issue that came up, so it's a little bit delayed, so I apologize. We, at this time, if it's a new symptom, so there's kids with sniffles and kids with symptoms that are known allergy symptoms, but if it's a new cough, a new cold, they will need to be evaluated for COVID-19. If they cannot be evaluated for COVID-19, they will need to stay home and be treated as if it's COVID-19, so not be allowed to return to school for 10 days. And so this is something that we're working on now to increase access to testing for children. Testing is much easier. There's much higher access of testing for adults, and now we're working with Marin Health, with our own color system, and the other, with Kaiser as well, to make sure that the pediatric adolescent population has access to ready testing. And so the question of when do we want to know about that, I'm going to defer to the nurses on that one, because I don't want to know about it until it's positive, but defer to Sandra and Marcia.
I think more of the question, it's around how do you take responsibility? So if there's a child with a cough, that sounds to me like a new cough. It's a COVID symptom. So I throw it back on the public health liaison, but maybe they were too busy and the child just showed up at school again today. And let's say this may have happened.
No, I can see that. I think that's where hopefully with the publication of the guidance, so parents are more educated and understand that that's their responsibility is key. Like, again, I can't overstate the parental role in this, and our role in educating parents, that they have to keep that child home unless they can get the child tested, or that child staying home, and we call it presumptive positive. That's our doctor talk, is that kid's positive until 10 days out. And that's how we have to treat it, again, in these early days, because we don't want to jeopardize access to in-classroom education for all because of that. I appreciate the challenge from the public health liaison role and just understanding the staffing issues of managing that. And so I think that's where, and this is where we can problem solve with the public health liaisons. But in my head, it's almost creating a line list and making sure there's a communication with the teacher that they know that the student should not be arriving at school. Like, I can see a campus and a child arriving and not being known to the office until 9 o'clock, 9:30 in the morning, making sure that the teacher knows that this person is been sent home under investigation. That's a word that popped in my head, but under investigation for COVID-19, and cannot return to school until there's a negative test or it's 10 days. So.
Okay.
So to jump in to your prior question, what we would ask of public health liaisons is to organize that line list as soon as possible so we know who, so we do want to know who your PUI is, your sick kid who we don't know what, if it's if it's COVID or not, and then to get that test result as quickly as possible. If that child comes back positive, then we have that line list, including staff, right? And this is where the multiple cohorts, you start to get involved, because then you can, if you're tracking those cohorts, then we can know, well, this staff person had potential exposure in 2 areas.
Can I ask a question, just sort of piggybacking on this, because we've had scenario 1 pop up quite a few times. We've had, a kid that at lunchtime reports, my throat's a little scratchy. So we obviously send them home at that point. They go home, take a nap, they wake up and they're fine. So for something like that, we've been very clear that we want them still evaluated by a doctor. We want a doctor's note before they can return. But for situations like that, would you still want us to require a COVID test? Or is something from their physician stating that whatever they might have had past, they don't feel it's COVID related? Is that good enough?
All three would be acceptable. The physician's note saying they're clear to go back, the 10 days, or the negative COVID test. And so we've been working with the physicians on the development of this guidance, and as you all know, there'll be variability in practice. But honestly, what we're seeing with kids, and Janelle really described it aptly, like it's asymptomatic, mild, a passing moment. And that's what it is it doesn't present like it does in adults. It's this very, very mild disease. The good news around all of this is that this mild disease is not as highly contagious from kids, excluding your high school kids. So again, over the age of 12, it's different. It behaves differently. But in that under 12 age group, it's not highly contagious. We have reported we had that one classroom, that one preschool to preschool classroom transmission. So it is possible though. So again, this is where we're going to be erring on the side of caution. And it'll be interesting to see some of the variability in doctors, where doctors just clear it and say, no, it's this. Because in the reality is 90% of the time, it's not going to be COVID. And it'll become a frustrating exercise for many of you on this call, because they're going to send a kid home. I've already gone through it, and it's so frustrating for me, and I'm in it. And you're like, this kid doesn't have COVID, but the kid's getting COVID tested, and the kid's staying home for 10 days. And I think we're working closely with Marin community clinics, because our concern is inequity, where, I have privilege, I have access to health insurance and rapid testing. We want to make sure that our kids who've been disproportionately affected by the virtual classroom, especially children that have low English literacy in the household, or lower income communities, that they can get back to school, and that they're not punished by a 10-day, virtual. It's not. It still will be virtual, but we know for these kids, they need to be in the classroom. It's the best place. So that will be our challenge together, is making sure kids have access to this testing, and it will be a pain point for all of us, because again, I'm going to say 95% of the time it's not going to be COVID, but our role is into keeping schools open is to be on guard and making sure we catch the less than 3% of the times that it is.
One last question on this. What if it is a sibling that isn't attending our school, was sick, and our student doesn't have any symptoms, but yet they were in a household with another child who was sick? In that case, what should we be requiring for our student to come back to school?
So that child would be, so it's the same, they're part of now a potential household exposure. So that child needs to stay out of school. So I had a scenario, my daughter totally wasn't COVID, and I knew it wasn't, but she had a fever and she had swollen lymph nodes. I had to pull my son and daughter out of school until the COVID test came back negative, and that's when they went back to school. And that's again where we're going to have to really work with educating the parents. I was frustrated, and that's going to be, and we appreciate that it's not going to take long for that frustration to build, because kids get sick, and they get sick with that. Well, they get sick with lots of other viruses, and kids are going to be out of school longer. And right now we're still in the red zone. But with schools reopen, so in my head, we're in the red zone, so a lot of parents might still be working remotely. But as teachers go back into the workforce, teachers also have their kids in school, and I'm very aware of that reality of teachers with kids, and then also having to go and get their kids from school. And so really having your backup plans ready for substitute teachers to keep that staffing the schools open. And that will be one of our challenges. We saw that even with power outages is when Sonoma students, when Sonoma schools closed because of extended power outages, we were faced with staffing challenges. And so I think we need to anticipate the same thing with COVID, where your teachers and staff might also not be as available because they're at home with childcare issues. So we're all in this together.
So you got, Dr. Santora, so we have a few minutes left, and the questions are starting to fly in now. And these are, again, a couple that have come up in the past, but as public health liaisons, you may get asked this question. Is there any new guidance expected about student or parent employee travel that's required, that they're required to quarantine afterwards?
There's no requirement for quarantine after travel. When people, like, this is again really on outreach and education, is that when people are traveling, they can travel safely as long as they're maintaining physical distance and limiting social activity. And so, and just the prevalence in California, that we're not a low risk, it's not, we can't contain it anymore. So there's no need for quarantine. That being said, there's already early conversations, and the principals will know better than me, is that there's more risk of when students are going outside the state and engaging in like contact sports that would be not allowable in the state of California, but is allowable out of the state. And so we are now just, we don't have guidance yet, but those are the things where there's known, I'd say there's known risk, when there's known risk behaviors, how are we gonna help parents navigate or have schools make decisions around that? So it's TBD, and I apologize for that. It was something that I hadn't even considered, but it is a reality for many students that they do go out of state. And there are states that have more, for example, Arizona, close states that have more lax behaviors and laws right now regarding wearing a mask, for example, or social or sports. So that's something that we'll be evaluating internally. The travel, you're okay. No quarantine returning from travel. But monitor for symptoms.
Yes, there's a question about, and I know you've covered this before, but just a little bit more about the 5-day wait after exposure for testing. So for example, our student whose parent had tested positive, their last day in school was Friday. We find out the next Wednesday that student tested positive. So that's a 5-day window already when our cohort first knew that they were exposed. Can you say a little bit more about that, Lisa?
Yes. So when let's say you're in a room and there's COVID all around you, and you wipe your nose and you're not wearing your face, and it introduces into your body. So you've broken everything. You've broken all the rules. And so now COVID is in your body. Well, you might not actually develop an infection with COVID. Your immune system may be able to respond, and you don't even become an asymptomatic person with COVID. Your immune system may be one of the lucky ones that can just fight off an infection, and you would never test positive for COVID. Or what then happens, not one of the lucky ones, it takes time for the virus to replicate. So, or to double, increase the amount of virus that's actually in your body. And so studies have shown that actually the best day to test is on day 8. But because of the sensitivity of the test that we have now, the PCR test, which is just finding genetic material, we are recommending testing between 5 and 7 days after that exposure. So at that time, if you can imagine, you're not one of the lucky ones. So your immune system hasn't been able to kill off all virus in your body. You're one of the unlucky ones. It takes time for that viral load to keep increasing to where it can become detectable when we are to test. So there's a 2-day pre-symptomatic phase. We know absolutely we'll have a lot of false negatives. That's what we call it, false negatives. If we test too soon, if you've been exposed, you're not even having symptoms yet. When you have symptoms, that's indicating that your body's actually detecting that there's enough virus in your body for you to try and mount inflammation to kill the virus. So your antibodies didn't work, that first line of defense didn't work, and that's when inflammation comes. So that's when there's a higher viral load. And then your body's second defense is trying to come in. So that's why day 5 to 7 is probably the best time for us to identify that someone actually has the virus. And if we tested too soon, you'd have more likely to have a false negative.
Thank you. So, we're going to take this last question and really, this is really more probably a rapid response question. Not necessarily, but it goes right to the heart of we're in tier 2. Schools are permitted by the California Department of Public Health to reopen in Marin County if they have a school site specific protection plan submitted and reviewed by public health. And it goes to the heart of guideline number 12, having to do with high school and middle school students. And so, Mark, this is, again, very detailed. And I would say that before I read the question, the answer is, read guideline 12 and come up with your plan of how to implement it in the most effective way at your school. But so it says at middle school and high school, specifically larger middle school and high schools, are pure 1 to 15 cohorts required? I'm going to say the answer is no, based on guideline 12. Or can students go to their classes as normal, meaning they all see all 6 teachers in a day in different classrooms? I'm going to say the answer is no. But and I'm sorry, I don't have it right here in front of me. I'm having a hard time scrolling through this. But say half the class, yeah, so it's too detailed a question for me to go through every scenario, but the bottom line is this, and Dr. Santora, if you can clarify, my understanding of guideline 12 is that in high school and middle school, larger cohorts made up of multiple classrooms, can be formed. And I think that with multiple teachers, but there is a containment, and kind of you formally, I think you or Dr. Willis have said about 100 students is about as much as we'd want to get in a high school or middle school cohort. So it's not school as usual. It's a cohorted strategy. Can you speak any more to that?
Yes, and I think this is going to be the challenge of the return for secondary education, is that our recommendation is that it's no more than 100 students in that cohort. And it's much more difficult as you go up, because that limits the classrooms that a student can be in. Because let's say you have 5 classes, 6 classes in a day, and then all of a sudden you're getting up to that 100 cap. That is not guidance that's given from the state. That's Marin County being more restrictive than what the state guidance is. And I think that's, as we're in these earliest phases, the high school environment is the riskier environment. And so to have a cap on that total cohort that student can be in will allow us to be more supportive at this time from a public health perspective in the contact tracing, which is our role. So I think that's where the kind of trying to plot out a high school schedule, and how do you keep a student under within the cohort of 100 in certain groups. I know I was in we called it alpha group, and I was with the same 20 nerds every day. So that was the easy cohorting, because you have these track students. And I think that will be the challenge in middle and in high school, is how do you create tracks that allow students to have in-classroom education, but also try and keep the cohort less than 100. So if there is, and the reason behind this, if there is an outbreak, it'll prevent us from having to close the whole school down. That's the intention behind it. At this time, we don't see that changing. There's nothing in the conversations that Dr. Willis and I have had around changing that recommendation, and we know it creates it's a barrier. But like I said earlier, the adolescent high school, the disease behaves much more like an adult in that environment. And we also know the adolescent brain loves to socially connect and not follow all of the public health recommendations that we give. And so that's why we have that more restrictive language ourselves. So it's not business as usual in the secondary and the secondary level.
Okay, so it's reached 4 o'clock. Dr. Santora and your amazing team, we can't tell you how much we appreciate you and your partnership and your support through this incredibly challenging time. Janelle Campbell, you're my hero. Melina, thanks for your help today. And public health liaisons, you are stepping into really some of the most critical work that we have in our community to support the safety and well-being of our students and staff. So thank you everyone for being here. We'll get together again next Wednesday at 3 o'clock, and then feel free to send us questions that we can preload, and we look forward to seeing you all next week. Bye everyone.
Thank you, Mike.